Hello. In this video, we will learn how to correctly perform clean intermittent catheterization, or CIC. Your provider has asked you to perform CIC because your bladder does not empty completely. CIC is an easy way to empty your bladder completely and decrease the chance of getting a bladder infection or injuring your kidneys. This may need to be done every 4 to 6 hours. Your medical team will help you set a schedule that is right for you. CIC is a skill that is easily learned with practice and repetition. You will need to catheterize often enough to keep the amount of urine drained below 300 mLs, or about 8 ounces. It is essential to establish a daily routine. Using a diary to keep track of the number of times and amount urine voided will help you establish that daily routine. You should plan to catheterize yourself in the bathroom. Before performing CIC, you will need to gather your supplies. First, you will need a catheter. Catheters come in different shapes, sizes, and lengths. Some catheters are pre-lubricated, and a hydrophilic catheter does not require application of gel lubricant. Other catheters might require water-soluble lubricating to help provide comfort and ease with insertion. Never use petroleum-based products on the catheters. Second, you will need antibacterial soap and water to wash your hands and a moist towelette or a washcloth to clean the opening. Third, a toilet or urinal basin will be needed for draining. You will also need a clean, flat surface on which you can lay your supplies. To catheterize, start by washing your hands with warm water and soap and dry with a clean towel. You can use gloves after washing your hands if you choose. Open the catheter package and lubricate 2 to 4 inches of the catheter tip with water-soluble lubricant, if the catheter is not already pre-lubricated. Position yourself for comfort and easy access during catheterization. You may stand or sit on the toilet. If you're not performing CIC in the bathroom, you may sit on the edge of a seat using a urinal for drainage. Men who are not circumcised should pull back the foreskin before cleaning. Clean the tip of the penis in a circular motion going outward using antibacterial soap on a washcloth or with a towelette. Hold the penis and stretch it at a 45-degree angle from your stomach. Then, insert the catheter slowly into the urethra using steady but gentle pressure. Take care not to touch the tip of the catheter on any surfaces before inserting it into your penis to avoid contamination. When you have inserted at about 6 inches, you may meet resistance. This is because you have reached the area of the sphincter muscle or you are meeting resistance at the prostate. Use gentle but firm pressure on the catheter until the muscle relaxes and the catheter becomes easier to advance, and you can pass it by the prostate into the bladder. Continue with insertion until you see urine flowing. Once you notice the flow of urine, insert the catheter 1 more inch. Do not press down on the bladder to empty it. The bladder will drain by gravity. Hard pressure on the bladder may actually push urine back up into the kidneys. The toilet or urinal should be lower than the bladder to aid in drainage of urine. Keep the catheter in your bladder until urine stops flowing. Once the urine has stopped flowing, remove the catheter, taking time to stop any time when urine begins to flow again to ensure that the bladder empties completely. Once the catheter is out, wipe the lubricant off your penis. If you are not circumcised, pull your foreskin back into its normal position. When finished, wash your hands with soap and water. Call your doctor if you have trouble passing the catheter into your bladder or you are unable to empty your bladder completely. If you develop signs of infection including fevers, chills, nausea, vomiting, or increased bladder spasms, notify your doctor immediately and increase your fluid intake. If you increase your fluid intake, it is important to remember that you'll need to increase the amount of times that you perform CIC. CIC may be difficult at first, but is easily learned with practice. If you have difficulty performing CIC, please contact your